Hello, and welcome to Mental Health Matters Podcast. I'm your host, Liz Lang, and I'm here with Dr. Mark Burton. In this podcast, we will talk about all things mental health. Thank you so much for joining us. Hey guys, Liz Lang here, and this week we are very pleased to welcome back Dr. Adrienne Burton Denmark. So as we mentioned before, she is the lovely daughter of Dr. Mark Burton. And Adrienne, I'm going to let you go ahead and just give yourself a brief introduction and specifically explain your work with the youth, because this week we're going to talk about teen suicide. And so give us a quick explanation of what qualifies you to talk about this.
Sure. So actually in my graduate work, my research focused on college mental health and specifically suicide. So at the time I was doing a lot of research about suicide among the college age population, which is just one age bracket up from the group we're talking about today and actually, has overlap. And so a lot of the stuff that's true about teens is also true about college students, like it being the leading cause of death among this group because they don't die a lot from other things.
Right.
And so it's certainly something we take seriously. And in my research, our approach to that will certainly inform our discussion today, that we won't, just talk about deaths by suicide, which is sort of the tip of the iceberg in this population. Because actually, compared to suicide rates for older adults, it's much lower.
Right.
In terms of how many people actually die. But then there's this much bigger problem with serious suicidal ideation, which is really common in this group, and suicide attempts. So, seeing this as an iceberg, if you look at actual deaths, that's the tip. And then there's this much bigger phenomenon of suicidal thoughts and suicidal distress, suicidal behaviors in this age group, which is what we focus on more when we're talking about prevention.
Right. And I think one big, factor that probably goes into this is that underdeveloped frontal cortex. The brain does not fully mature until around age 25, which is usually around the time most people are graduating college, right? And entering the work field. And so, and a big part of that underdeveloped frontal cortex is impulsivity, which I think adds to that, adds to suicide attempts, is because, your brain is not thinking as rationally and you tend to make more impulsive decisions that bear greater consequences.
So I researched this in the college mental health population. I worked a lot with college students in my training and adolescents for a period of time, but then I really started working a lot with teenagers in 2018. Became, a sizable amount of my practice, tremendous amount of my practice during the pandemic because they really needed the most help and they were home from school, so I could see them all day long by video.
Yes.
And then since then, that has continued to be maybe about a third of my clinical group.
Yeah.
And I tend to follow these teens from, when they start working with me, which might be, 13, 14. Often I'm still following up with them at times as they, launch. And then I get to see this sort of longitudinal growth trajectory, which is really wonderful when you can get people through the teen years and then into their young adulthood and see them just thrive.
And that has to be very satisfying and highly rewarding. I mean, because, we all can remember just the difficulties of those teen years and, that angst of social pressure. That's so huge. I mean, I can still remember how important my social group was through high school, and that started in junior high. And I'm starting to see it with my oldest, who's 11, and her friend group is becoming so important to her.
Yeah, and my oldest is also 11.
Yes. Yeah. And so they're entering that phase of development where peer groups are really important, and peer acceptance is also extremely important, which we're going to delve into a little bit. So I want to just start by addressing the suicide rates. So last week on our episode of The Sobering Truths of Suicide, we were kind of discussing the different suicide rates in different age groups. And It's my understanding that it was the third leading cause of death for, I want to say 10 to 14, and it's dropped down to the fourth leading cause. I think the number one leading cause for that age group is accidents.
Yes, number one leading cause is still accidents.
Yes.
But actually, so that's interesting. When I was checking on the data, I didn't look at, kind of where it was in the causes of death,
Okay.
but it actually usually hangs out as the second leading cause of death
Okay.
for this group.
Okay.
Yeah, I don't think that has changed.
Okay.
Just in that I know that there has been a rise, like starting in 2008, really. Like
Hmm.
go back to the days of the financial crisis. You remember that?
Yeah. Oh,
Like,
yeah.
our current teenagers weren't anywhere in existence then, but teen suicide rates started rising then and,
Mm.
have sort of kept a relatively slow, steady rise, even
Okay.
continuing post-pandemic.
Right. Which, again, I think leads to this sense of hopelessness, because I think that's what a lot of people felt in that, the 2008 collapse of the housing market, which led to a major economic recession, nearly another Great Depression.
Yeah.
Uh, I mean, it left a lot of people feeling hopeless and bleak about the future. I mean, I remember feeling that.
Yeah.
I mean, I was in high school. That happened like I think it was my junior year. Yeah, my junior and senior year of high school is when that really hit. And I couldn't help wondering, what does my economic future look like?
Exactly.
And which could bring us to a really important point in all of this, is that human beings are pretty resilient and we're really good at adapting.
Uh-huh.
And I think that that's something that we could probably help our youth understand more, is how adaptable people are. And so when things seem really hopeless, it's not that you need to invalidate this sense of hopelessness. It's
Right.
not that you need to decide to pretend it away, but try to think beyond it, and that this is not a permanent feeling. This is just a temporary feeling. And, we have the ability to move past it.
Yes, and in fact, when you can join in that, it's really powerful when you can
Yeah.
say, "Oh yeah, I've felt that way. These are times in my life when I've been really hopeless."
Yep.
And if it were true for you, and even I wondered if life was worth living, and then I kept going, and then things got better. When there can be stories that they can relate to, someone they're close to, who has struggled in similar ways, or knows what it is to be hopeless, knows what it is to be depressed or anxious, and then they see that story have a positive outcome.
Yeah.
Not that like your life will never have struggle again, but that,
Hmm.
you've come through it to a place where I'm assuming you aren't dealing with hopelessness the same way that you might have been when you were a teen.
Oh yeah. Yeah. I mean,
Yeah.
absolutely. I'll admit it looked bleak. Here I am getting ready to graduate high school and go into
Yeah.
college and wondering, what is my life going to be like? And
Yeah.
again, as you said, it's not that my life has been without struggles, but I mean, I've done pretty good, right? I
Yeah.
mean, and I feel pretty good about where my life has gone since then. So, another thing that I want to discuss is social media and adolescent suicide. Now, we know that everybody, all the humans, would benefit from limiting their exposure to social media. It's just all around a good thing for your mental health, for everybody, but particularly adolescents. And so I'm curious if you think there are any benefits to youth being on social media.
Well, yeah, when we're talking about this in particular, there can be a benefit. Overall, honestly, I would say if we could abolish it tomorrow and just abolish it for everyone,
Hmm.
we'd all be better off, and certainly
Okay.
our teens would. But we can't do that.
Nope.
Um, and their friends are on it, and
Hmm.
this is a way that people are seeking connection. So there are some, interesting statistics when we do look at deaths by suicide, which
Yeah.
again we're not going to focus on, but the risk of dying by suicide for an adolescent is actually much greater if you live in a rural place where towns are
Interesting.
spread out, where you're not around your peers as much. There is also, of course, the overlap with access to firearms, which tends to be more true in those communities.
Hmm.
Gun deaths are the leading cause of death for this group,
Right.
like,
Hmm.
accidental gun deaths by violence or
Yeah.
self-inflicted gun injury. And so there is nothing that puts a kid more at risk for dying by suicide than having access to a firearm.
Right.
Uh,
Which
the
is, yeah, which is just another friendly reminder to be a responsible human being and lock up your gun, secure your
yeah,
weapons.
if parents want to learn more about this, the Be Smart campaign.
Okay. Hmm.
They can just Google it, and it goes through different steps of, it's not just about the gun safe. So a lot of different information about how
Mm,
to be a safe gun owner.
yeah.
Um, because what a lot of parents might not realize is that, like, if they haven't changed the combo to that gun safe in a while, like, they might not know that their kid actually knows the combo.
Yeah. That's a good
That
point.
the so there are a lot of different resources on there of how to be like a super safe gun owner. Because I know it's an important part of a lot of people's culture,
Yeah.
and no one wants something horrible to happen.
No, they don't. Well, and I think a lot of people assume, well, they're not going to get access to it. My kid isn't going
Yeah.
to get access to it, which majority of the time is probably true. In fact, I was just having this conversation with my father-in-law the other day. He's like, how would they even get a hold of this gun? The kids don't even go in my room, in my closet. And I'm like, you're right. Our kids don't. But would another kid? What if the kids
Yeah.
are over, right? Or what if a friend comes over and they happen upon it? Like, it's just not worth the risk.
Yeah, you never know. They're playing
Yeah.
hide and seek, they end up in the closet.
Yep.
Like,
Yep.
And so I do highly recommend that actually people who aren't gun owners also look at the
Hmm.
Be Smart
Yeah.
website, because it has questions you should ask,
Hmm.
of people whose houses your child will be spending time at.
Yeah.
Because you're right, it might not be in your home, but,
Yep.
going to be in a friend's home. Anyway, that was a little aside, but has to
Yeah.
do with,
Yeah.
important prevention information. But the other part of that finding, and the rates are dramatically different when teens are living in these isolated areas. So it's
Hmm.
also, there's a got to be a component there about social isolation.
Yeah.
And so sometimes for those higher risk teens, especially, that's going to be the way that they connect to a broader community.
Hmm.
Especially if they're in a minority group,
Yeah.
LGBTQ plus
Hmm.
teens, that might be the only way that they can be their authentic self in a safe
Right.
way
Hmm.
in those communities. So yes, like social media can be important. And so for parents, I think it's important to know that amount matters, that when we're seeing, much higher rates of depression, hopelessness, and suicidal thoughts, you're seeing that when teens are spending more than 2 hours a day on it.
Yeah.
And you see that more when they are sort of passive, when they are scrolling on social media.
Hmm.
That's more negative impact on their mental health rather than when they get on there to post something or get on there to communicate about something.
Right.
And so it is really important, kind of like we're talking about firearm safety, social media safety. You can set time limits on different apps. And I think any parent who's having that discussion with their child about like getting social media
Hmm.
should definitely include a discussion about time limits, and that this can be, ideally it's not something where the parent comes in and says, well, this is how it's going to be. That it's a collaborative discussion about the reasons why, and what do you
Yeah.
think works, and where are your friends hanging out mostly,
Yep.
you know and what is that like. So ideally the social media conversation is a very shared one. Parents also should hold themselves to the same standards that they're asking their
I
children
agree. Yeah.
to.
Yeah.
And, this conversation about like, look, it's not a private space. Uh,
Yes.
it's not a private space out there in the world, so we're not going to treat it like the private space in our home, right?
Hmm.
That parents do have access to their kids' accounts, and that the understanding is that they're going to be like looking at them sometime, and they'll sit down with
Yeah.
you and look at it, right? Decreases the chance that some of the worst case scenarios are happening on social media, because certainly being the target of online bullying is a huge
Hmm.
risk factor for
Yes.
teen suicide.
Yes. And I think it's important to reiterate that you're right that there can be benefits. I mean, think of how beneficial social media was as we went through this pandemic and people were connecting online. That had to have been instrumental for these teens who were isolated from their friends, right? So, yes, there are benefits, but I think that if parents set the expectation that not only do I need to have access to your social media account, I want to be involved in it and make it clear this isn't a way for me to snoop or a way for me to pry into your life. This is just a way for me to be involved and to help keep you safe. And, this is probably going to cause tears, maybe anger, maybe frustration.
Sure.
We have a very strict policy in our house that you are not allowed to just sit and browse YouTube, right? My
Yeah.
kids are not allowed to.
Yeah.
And my daughter had a serious meltdown about this, about being 11 years old and thinking, I'm so uninformed about the world. And I said, kid, the internet is the absolute worst place to get information. And
Yeah.
so again, it's this idea of having these discussions about safety, about boundaries, and how it's really because you have their best interest. And they're probably not going to understand it in their adolescent brain, but
Sure.
eventually, hopefully, as an adult,
Yeah.
they will.
And, it is easier if you're having these conversations early,
Yeah.
before they have access to a smartphone, before they
Yeah.
have social media accounts.
Yeah.
But even if you haven't, it's never too late to be like, hey,
Yeah.
I came across this new information and,
Hmm.
I realized that this is an area where I haven't been as involved in your life as I should be.
Yes. Yeah. You're right. And, consistency is always key. And so, it's one of those things where you have to follow through with it, or, your words aren't really going to have meaning to your kid if you don't follow through and say, I'm going to now be involved in your social media life. You have to
Yeah.
follow through.
Yeah.
Okay, so
You pointed out like we used it during the pandemic to
mhm,
connect, and
yeah,
it can have that function.
yeah,
And also, it is not the same. Your brain does not
yes,
register it as the same as in-person social connection, which is just always the best form. And
yes,
so
yeah.
I think with our teens, we can encourage them to do most of their socializing in person, right? Uh,
Yes, I'm glad you brought that up because I think that is probably the number one most important thing about social media is, or one of the biggest dangers. I don't know if
mhm.
maybe it is the biggest danger, but it's certainly a really big danger is that teens will tend to think that it can replace in-person
Yeah,
socialization, and it just does not.
yeah,
It's not the same. So, as human beings, we are hardwired to connect. It is integrated deeply into our genes.
yeah.
And that connection is not the same online as it is physical in person.
Exactly. And this is really pertinent, broadly when we're talking
Yeah.
about, sort of a pandemic of loneliness and social
Yeah.
isolation that a lot of teens are feeling, but especially when we're talking about suicide, the big driver of suicidal ideation in all age groups is a lack of belonging. So
Mm,
when teens lack a sense of belonging, they
yeah.
are far more at risk for considering suicide. The other twin of that is a sense of burdensomeness. So
Yeah.
if you're not actually getting any social connection in a way that your brain experiences as truly belonging, and if you have this sense that maybe the world would be better off without me, maybe my parents would be better off without me, those two are the combination that leads to thoughts about dying by suicide.
Yeah. Which can be a scary
Yeah.
place to be. And well, hopefully you've seen the science before then, and you're getting help. But if not, well, it's obviously time to seek professional help.
Which I thought would it be helpful to talk about kind of the latest data on that, on suicidal thoughts and behaviors?
Yeah. Yeah, let's
Just
do it.
because, like I said, it's an iceberg, and so
Yeah.
that's, the part we're looking at. And they do this youth risk behavior survey,
Hmm.
uh, and they do it every other year so they can compare, like, the most recent data is 2023. They can compare that to 2021, and they also compare it to a decade ago, and they do this kind of update it every 2 years,
Okay. Yeah.
um, to try and see what the trends are in like youth mental health and a whole bunch of things. Because I think people might be surprised by how common serious thoughts about suicide are. Right?
Yeah.
I was saying
Okay.
the actual deaths by suicide are fairly low in this population,
Hmm.
but like rates of suicide, 27% of female students said they seriously considered suicide in the past year.
Wow.
Um, 14% of male students said the same thing.
Hmm.
That's just like, I mean, I
Yeah.
know the data. I've been involved in this research for a long time, and still, every time I hear that, it's just like, really, like
Hmm.
almost a third of young women are seriously thinking
Yeah.
about suicide
Yeah.
in any given year.
Yeah. One
Um,
in three. That's
yeah,
staggering. Yeah.
yeah. And if you break that down by LGBTQ plus versus cisgender heterosexual students, there's an even more dramatic difference. 41% of
Mm.
LGBTQ plus students have seriously considered suicide in the past year,
Yeah.
compared to 13% of cisgender
Right.
heterosexual students. So there are some groups that are like, you know, female students, LGBT students are more at risk.
Right.
And that translates into action more than you might think it does.
Hmm.
13% of female students said they made at least one attempt in the past year,
Yeah.
6% of male students. So it is I think, a more prevalent issue than a lot of people would want to believe. They'd want to believe, yeah, like my kid seems really happy and well adjusted. I don't need to talk to them about this. But if we look at the data, that is, really not true.
Hmm. Right. Well, and I think that being with this sense of connection and this belongingness, that really needs to start within the family. And, hopefully parents can be involved enough in their child's lives that they can see the early warning signs, like your child is more withdrawn, your child is speaking less, they're coming home from school downtrodden, they're sleeping more. All these early warning signs of depression. Because what's staggering to me is that 27% have seriously considered it. How did it
Just in the past year.
just
Yeah.
in the past year, how did it get that far? I
Yeah.
mean, how can we encourage teens to seek help before it gets there? I mean, I think that teens need to have a safe adult that they can come to and say, I am dealing with this awful depression, or I am feeling these deep feelings of just lost and sad, and I don't know where to go. I don't know who to turn to.
Yeah.
You, I mean, and that can be really hard. And as parents, I know that you want to be that person for your teen. So, I mean, I'll share an example of my wonderful mother stepping beyond herself, right? So, as a teenager, it was my senior year of high school, and this is totally unrelated to the economic situation. This had more to do with just kind of myself and interpersonal relationships. I was in this really dark place, and it wasn't that I was necessarily suicidal, but I had some of those early warning signs. And my mom, I mean, as a teenager, she drove me crazy. We get along really well now, but my goodness, I still don't know what it was, but she wasn't someone that I could confide in. And my mother, in her desperation to help me, reached out to a youth leader from church and called her. And to this day, that woman is instrumental in helping me through that difficult time. And now I really appreciate my mother being willing to put aside her pride and her emotional attachment to do what she needed to help me. So if your youth is struggling, or if you're noticing these early warning signs, don't panic or don't be offended because your child doesn't want to come to you. Find somebody, anybody that they can trust, that you trust, and that they can trust, that can help them.
Yeah. And so, I'm glad you brought that up. That's
Mhm.
already, like, with our 11-year-olds, it's not too
Yeah.
young to be
Mm-mm.
having these discussions, and, discussions around mental health, discussions around who you can talk to. So,
Yeah.
I've talked to my kid about, like, hey, there might be a time where you are struggling with something, you don't feel safe talking to me about it. Let's look at the other adults in our lives. So, some family friends. If you don't have, a youth leader,
Yeah.
um, you may have a
Yeah.
close friend of the family, an aunt or an uncle, a grandparent, somebody, a sports coach, someone your child feels safe with.
Yep.
And if you've identified that in advance, of, like, that that's the person you could go to. How would you feel about that if you ever needed help, didn't feel like you could talk to me, to know that that's a safe adult you can confide in? Because at a certain point, they tend to turn towards their peers,
Yes.
and that tends not to be helpful with this topic in particular. So, setting up this idea of, like, yeah, you can go to someone else in your life. Also, for parents to not be afraid to ask. I know I said this last time when I was on
Mhm.
talking about this, but it's worth
Yeah.
reiterating.
Yeah.
If you're wondering, ask, and ask very directly, and say, like, hey, I know you've been having a lot of trouble with friends lately, or it seems like, school's not going as well, or you just seem not yourself. And I wonder, are you having any thoughts about hurting or killing yourself?
Yeah.
No. And, just to say it that cleanly
Hmm.
communicates that, one, that's like a normal thing we can talk about.
Yeah.
And that, two, it's something that, like, I'm not afraid. I'm not
Yes.
afraid to speak its name. And so I'm not likely to be panicked. I mean,
Mm-hmm.
honestly, I would I would be pretty anxious inside.
Yes.
Um, but on the outside with my teen, trying to be like, hey, yeah, this is a normal thing. There is help available. Like, you do not have to go through this alone.
It's sending that message that I can handle your big emotions. I can
Yeah.
handle your big, scary, overwhelming emotions. I can handle them because oftentimes these teens, it's confusing and it's roiling and it feels so overwhelming. And so having an adult that they can cling to for stability that can just help I literally carry their burden of, I can handle and I can help you carry these big emotions without panicking myself. And
Right.
again, if you can panic on the inside. In fact, I would be worried if you weren't panicking on the inside a little bit. But, just being again, it's trust and that bond, right?
Yeah. Because sometimes teens will signal it kind of sideways. They might start making comments like, oh, I should just kill myself, where it doesn't feel like it's a serious statement. It feels like it's
Yeah.
an expression of anger, and it might be just that.
Hmm.
And, and a parent might be one, caught off guard and scared and tempted to say something like, don't talk like that,
Hmm.
or two, to just ignore it because they're just being a dramatic teenager, and what's really ideal anytime a kid makes some sort of statement about that is like, hey, I'm not sure if you meant that seriously, but I take that really seriously. So,
Yes.
I do want to talk about that. That a lot of teens do have thoughts about hurting or killing themselves. Like, are you
Yeah.
actually? And if they're just like,
Yeah.
oh no, geez, figure of speech. Like, okay, great. I just want you to know that that is to me something really serious and
Yes.
something that I'm available to talk about. And
Yeah.
and then you move past it.
Right,
Uh,
right. It doesn't have to be this big to do or right or about it. It's just it's again, it's just sending that message. This is a big deal to me, right? And
mhm,
this matters to me.
yeah.
Okay, so I would like to talk about this idea that teens feel like they are always being scrutinized by their peers. And
Mhm.
it's a normal part of development, of psychological development. And it's so hard to describe, but it's like teens feel like and they're like their peers are always thinking about them and they're always watching them,
Yeah.
which can be so hard because all you want to do is just fit in. And when you feel like everybody is scrutinizing you, trying to figure out who you are can be really confusing at times. So, I mean, how do we help teens cope with this or, overcome it or prevent it from being a crisis? Because it's just a normal part of development that they're all going to go through. And so, what do we do as parents?
Yeah. I mean, one thing we're looping back now to the social
Hmm.
media conversation, but limiting the time that they spend in that world helps with
Mm,
this because they're actually being scrutinized online. They're
it's
like,
true.
this
Yeah. Yeah.
isn't a false perception when they're engaging with that. That's what people are doing. They're
Yeah.
looking and
Mm-hmm.
commenting and so the less time they spend in that world, the better.
Mm-hmm.
Because when they're just hanging out with their group of friends, they might be having those thoughts too of like, everyone's thinking about me, everyone's talking about me, and with that, you can also just ask them, like, well, how much time do you actually spend thinking about this person, thinking
Mm,
about that person? If
yeah.
they did that, would you notice it and let it go, or would you really be focused on it? And usually they can recognize that, yes, they would not actually be thinking that much about someone else who did this or, holding on to fixating on a peer's behavior. They're probably not doing that.
Mm-hmm.
So their peers are probably not doing that for them.
That's a good point, making it kind of an internal reflection
Hmm.
type thing, helping them to, or it's helping increase their empathy also,
Yeah.
in a way, helping them to think about how other people think and feel.
But when it comes back to what they might be posting online and things like that,
Yeah.
that's um,
Yeah.
you can have conversations with them about like, how does that actually feel? Like,
Yeah.
what is that like to sort of feel like you want everyone to see this photo of you or you doing this or to know about this? Like, does that also maybe make it feel like everyone's looking at you all the time?
Yeah. That's a really good point. Okay. So before we run out of time, one other thing that I really wanted to get to is the Netflix documentary 13 Reasons Why. So we know this led to an increase in suicide rates among adolescents. Why do you think that was?
It's actually a little more complicated than that. I
Okay.
think, right,
Okay.
and of course, this is not my field of research, so
Okay.
this is just research that I'm reading, and researchers are divided as to how to actually interpret the data. There was an increase in deaths by suicide specifically that started the month before
Okay.
13 Reasons Why was released and continued for, I think, like about 2 or 3 months after.
Okay.
That increase wasn't in the group you'd expect it to be in. It was all among adolescent boys.
Okay.
So researchers are split. There's really no way to say that 13 Reasons Why was causal in that,
Okay.
especially since the trend began before it was released.
Mm-hmm.
And some researchers are like, no, like this, we're accounting for all these other variables. It definitely must have had to do with this. And we
Yeah.
don't know why it's boys, but
Yeah.
that's who it seemed to affect. Because for listeners who aren't familiar with the show, it starts with the suicide of an adolescent female
Mm-hmm.
and then is going through her 13 reasons why. But whether or not that show actually was responsible for deaths by suicide,
Mm-hmm.
shows like that, like the way that it handled the topic, are certainly in violation of like the American Foundation of Suicide Prevention has these really clear guidelines for how media would ideally talk about suicide,
Okay.
uh, how it would and would not depict it.
Mm-hmm.
And so I don't think anyone working on that show consulted with them. They're available for consultation if you just look up their website.
Right. Right.
And this is, true from media outlets, especially like local media. If there is a death in the community that is a suicide,
Mm-hmm.
it would be really helpful for them to get on that American Foundation of Suicide Prevention website and look at the guidelines for how to do that safely because there are ways of reporting on suicide that definitely do cause increases in suicide, sort of contagion effect.
Mm-hmm.
That's pretty well documented. So
Okay.
it's reasonable to think like that something like that would have happened with
Mm-hmm.
13 reasons why because it did all the things you're not supposed to do.
Right. Right.
Even though it wasn't a real person, not a real news story, but like, depicting the actual death and depicting a whole lot of attention that this person gets afterward, because they died by suicide and kind of playing into this like revenge fantasies people can have when they're, feeling really disconnected
Yeah.
or bullied. So I think there are a lot of problems with that show. Also, the way it depicted sexual violence and things like that. I would not recommend that show. I know it wants to be like talking about hard issues.
Which you should, but there's a way to do it.
There's a way to do it, and that's
Yeah.
not it,
Mm-hmm.
sort of like misrepresenting kind of what drug culture among high schoolers is actually like and things like that where it's just like a teenager watching that is far more likely to be harmed than
Yeah.
for it to be some meaningful conversation starter.
Right. So, do you think suicide has been glamorized?
Well, it is and it isn't, right? It can
Mm-hmm.
be, and
Yeah.
sort of we can look at that every time it's discussed in the media or,
Yeah.
depicted in, kind of a book or a movie or a TV show. It can be glamorized or not, you know.
Okay.
So what we want is for it not to be, you know.
Right.
Uh,
So, one poignant example that really sticks out to me is Robin Williams' suicide. And I remember, this was so talked about in the world of social media. And I remember seeing this post of, oh, the genie is finally free. And I'm like, that felt like a glamorization, like he's finally free from these bonds of depression. And I'm like, but that is not the answer.
yeah.
Like suicide should never be a solution to, freedom from pain. Anything is better than death, right? From this intense emotional pain. And so I guess really it just comes back to the conversation, right? And the dialogue around suicide. And so the World Suicide Prevention, their campaign is changing the narrative on suicide.
Yeah.
That's their triennial or triennial, however you pronounce it,
Mhm.
slogan for suicide prevention is just changing the narrative, and that, suicide is something that we need to talk about, not to glamorize it, but to normalize that we can talk about this intense emotional distress, and that being okay, holding space for people to feel these intense emotions.
Yeah. Yeah. So some of the things, right, of like even the words you use
Yeah.
to describe a suicide, like really, it's, better to call it a death
Mm-hmm.
and never to use terms like successful suicide
Yeah. Yeah.
or completed suicide, right? That it would be a death by suicide, but not
Yeah.
to focus on that, right?
Yeah.
That, you know, ideally the conversation around that is about the person's life,
Mm-hmm.
not the way they died. And, never to get into the details of that, of how they died specifically. Because again, that can glamorize, that can create
Mm-hmm.
contagion. That's not what the conversation should be about.
Okay.
That the
Yeah.
conversation is about this person's life
Mm-hmm.
and maybe their suffering, right? That,
Yeah.
this life with all its ups and downs, struggles and challenges, and then the fact that there is help available
Yes.
for other people who are struggling, like that narrative is a
Yeah.
far more healthy narrative and honestly feels far more respectful to a person who has died.
Yeah. Yeah. Absolutely. Okay. So I usually do this at the beginning of the show, but I will say it now. If you or anyone you know is feeling suicidal, you can call or text 988, which is a fantastic new resource. Well, I mean, no, the being able to call or text somebody isn't a new resource, but well, or texting, right? So the resource isn't new, but being able to text, which is pretty impactful for youths, right? I know that was a pretty big deal. All right. Thank you so much again for being part of this very important conversation, just in terms of suicide and suicide prevention. And if you need help or if you need resources, I promise you they are out there. You don't have to be considering suicide to reach out to 988. You can just say, I'm feeling incredibly depressed, incredibly hopeless, and they can connect you with resources. So
Sure. Yeah.
they are available. They are out there. Your doctor, all sorts of resources. All right. So next week, we are hoping to be able to have a special guest, but it's not confirmed. So if not, then Dr. Burton and I will be back again to discuss another aspect of suicide. And in the meantime, I hope everyone has a good week.
Thank you.
Have a question for Dr. Burton? How about a topic you'd like us to cover? Send us an email at mentalhealthpod21@gmail.com. This podcast was produced and edited by Liz Lang. Music is by Audio Lounge.